All right. Hello, everybody. Giving it a couple minutes here for everyone to get admitted in that's in the waiting room, and I'll keep an eye out for other people joining. We are going to record this session tonight since we had a couple people that RSVP'd and were unable to attend. And that way we can distribute it out. Really excited for tonight's topic, and want to say a special thank you to Joelle for joining me today.
Hi, everybody.
Yeah, these prenatal workshops have been a big hit, and we've been excited to share the information with people that are both pregnant currently, planning to become pregnant, and are postpartum. So we're going to cover kind of a wide breadth of topics tonight in regards to physical therapy and chiro care. And as we do that, we'll certainly save time at the end to open it up for open forum Q&A in case anyone has some questions on the call that would like to throw those out there. But before we do that, let me do a brief introduction here. For those of you that don't know me, my name is Kristen Wilson. I'm a physical therapist and co-owner of Action Potential Physical Therapy. We have two locations, one in Glen Mills, Pennsylvania, and one in Kennett Square, Pennsylvania. And we do treat a variety of different conditions, everything from back pain to joint replacements, balance and falls. But one of the key programs that we've developed and are currently offering is a pelvic health program, which addresses both prenatal and postpartum care. And we find this to be a very rewarding area to work in, since a lot of women, for one, don't even know that this is something physical therapists do, and two, understand how to prepare for delivery and or recover from delivery when having a child. So certainly very excited to be presenting today with Joelle Renaud. I'm going to let her go ahead and introduce herself, as she is certainly an expert in this area and a welcome addition to our group tonight. So Joelle, go ahead.
Hi, everybody. So my name is Dr. Joelle Renaud. I am a chiropractor here in Newark, Delaware. I work with Pure Wellness, and I am the main physician at the Newark location. I've been with the company for about 10 years. I've been practicing for about 10 years, just over 10, I guess. And one of my primary focuses in my office is pregnancy, prenatal care, postpartum, and I'm also a doula, and I am a birth fit professional as well. Birth fit is just a separate designation of professionals out there across the country that have a specific purpose to serve the prenatal, the pregnant, and the postpartum people. And so I really love working with those types of people and those patients. And I do see everyone else too. So I do treat all different types of things. Of course, as a chiropractor, my primary focus is the spine. For women, the pelvis, of course, part of the spine. So I'm definitely paying attention to that. And I'm very excited to be here for all of you and to hopefully answer some really good questions that some of you may have.
Absolutely. And I think the other great thing about Joelle and I working together is we're both moms ourselves. So
Yes.
these are topics that, we hold near and dear to our heart because we've both been through this process multiple times.
Yep.
And certainly both from personal experience as well as professional training, feel definitely equipped to answer these questions and provide some guidance, especially if this is your first time with pregnancy. But even for the seasoned mom, these are some topics that oftentimes people don't quite know that much about. So we are here to debunk those myths and provide as much content as possible so that you have the answers to your questions.
Yep.
So in preparing for the presentation today, we wanted to come up with just some general topics about physical therapy and chiropractic and its use, both with pregnancy and postpartum. And one of the first things that I wanted to iron out for people is really kind of clarifying, when is it that you would go to see a physical therapist or a chiropractor during pregnancy, because there's certainly quite a number of indications that would explain why. So I'll dive in first and talk a little bit about physical therapy, and then I'll pass off to Joelle, who can talk a little bit about where chiropractic plays a role in prenatal care. So certainly in PT, a lot of the catalyst for coming to see a physical therapist for prenatal care is pain. So oftentimes as we get pregnant, our bodies start to stretch in a lot of different ways because of those hormones, and the pelvis begins to stretch in preparation for childbirth. And as a result of that stretching, people can often experience pain around the low back and in the pelvis. So oftentimes I will have people come to see me during pregnancy because they're having issues with pain. And that could be pain with rolling over in bed. Maybe it's getting up and down from a chair, walking, going up and down steps. And when someone comes to see me, my first objective is to help get rid of that pain as quickly as possible. So I will often teach people how to stabilize through the spine and the core to prevent that over flexibility from causing pain. That can cause relief in as little as 1 to 2 sessions. And then our focus shifts to maintaining that stability around the pelvis to prevent the pain from coming back. The other main reason why I like to see patients while pregnant is to help them prepare for delivery. And that can look like a variety of different ways. One of the first things that I'll do, and I typically will do this in about the 8th month of pregnancy, is I'll teach a patient how to do stretching of their vagina to help prepare for that delivery. That area is called the perineum, and we call it perineal stretching. That can be done either to yourself, or I can train your partner on how to do that stretching for you. What that does is it helps to open up the vagina and prepare that tissue for stretching to deliver the baby. And as a result, can help to minimize tearing or the need for an episiotomy. And we find that this is a really, really helpful way to prepare for that delivery. The last thing that we'll do during that visit is I'll also work with someone and teach them how to effectively push. Sometimes our bodies don't quite know how to do that, and they can't coordinate that task because, much like any other sport or task, we have to learn how to do that motion. So I'll assess someone in their 8th month of pregnancy to say, okay, do you know how to coordinate pushing a baby out? If they do, great. Give them a couple exercises to work on to maintain that coordination. And then if they don't, I can go over some strategies for helping to improve the efficiency of that pushing. What we find is that when someone can coordinate that task well, it can help to accelerate the efficiency of the pushing part of delivery, as well as help to minimize that risk for a pregnancy that isn't progressing or a labor that isn't progressing with pushing. So we find that it can be really helpful for making that person successful during the pushing portion of their delivery. So lots of different reasons why you would see a PT, namely pain around the pelvis or in the spine. Secondly, to make sure that we can get some stretching of the vagina. And then last, to help evaluate and strengthen your ability to push out the baby. Joelle, let me pass off to you.
All right, great. So with chiropractic care, our main goal as chiropractors is to help the spine function better. By helping the spine and the joints and the muscles of the spine function better, we're helping the nervous system do its job by controlling our entire body, including, and of course, during labor and delivery. We can imagine that that would be very important, that those signals are firing correctly. So just like some of the things that Kristen has already mentioned, just that we're coordinating everything together and we're able to have the most comfortable and the successful labor and delivery that we can. So that's just the basis of chiropractic in general for everybody. More specifically for pregnant women, I want to see them if they're in pain, of course, but I'd love to be able to treat patients from even from preconception. The idea would be that the better that your spine is functioning, the less pain you're going to have from the beginning of your pregnancy to the end, the less pain or dysfunction you're going to have in labor and in delivery as well. So it would be really important for any patient who's looking to begin their journey starting a family to check in with me. Come in, get an assessment, even if there isn't any pain right away. Get an assessment. I can do an evaluation of the spine, and I can provide care to all the areas that need it. When a lot of the times patients are waiting until they're in pain to come and see me, that's fine. I can start anywhere during pregnancy, from the first early days when you just find out, all the way up until I've seen women come to me, within days of delivering. So I'm there for whatever phase is possible. And again, my goal during pregnancy and postpartum is to make sure that the spine and the pelvis is functioning correctly. All those joint restrictions are corrected, and the patient can then have a very successful birth. Another big part of, and I know, Kristen, I think we were going to talk about this, but the other big part of chiropractic in pregnancy is the Webster technique, which a lot of women are familiar with for breech presentation. And so very simple, very basic. I'm not turning any babies, but I am providing service and removing restriction of the pelvis of the woman who is pregnant to then assist optimal positioning of the baby. And again, this is something that some people search for me and find on the International Certified Chiropractic Pediatric page. I'm a Webster certified practitioner. So some people will simply seek me out for that particular purpose. But that is something that I also work on. And we can elaborate on that in a little bit, unless you wanted me to do that now.
Go for it. Yeah, you're right.
Okay.
You're on a roll. Go
Okay.
for it.
All right, cool. So so again, to further explain that, the Webster technique, it's a technique where we address, as the chiropractor, I address the sacrum and the pelvis of the woman, as well as the round ligaments and the sacrotuberous ligaments, which so the sacrotuberous ligaments are in the buttocks, and the round ligaments are, I'm sure many of you who have had kids can understand that the round ligaments are the ligaments in the front that support the uterus. And what happens is if we're imagining this as our pelvis in the back, and we're imagining this as the round ligaments in the front, they get a little bit twisted. And so usually what we're finding is one side in the lower back and in the pelvis is restricted to one side, and then the round ligaments are restricted to the opposite side. And by correcting those two things and bringing them back to normal, that allows the baby to have optimal positioning within the uterus. And so this technique is wonderful. It's worked. I've performed it on many patients at this point in my career. I don't have any specific data as to how often and how well it works, but I know that there are plenty of babies that have then, gone head down position. And then there are some women, of course, that it just does not work. And my thoughts on that are just, that's baby trying to tell us something. And of course, there are other medical procedures that can be done in that instance. But commonly what we'll do is I'll assess the mother. I usually kind of time it with their OB appointments or with their ultrasounds, and make sure that I'm providing care between those appointments so that we can check on baby's position. I don't check baby's position, so I rely on the other providers to help me with that. I rely on the OB or the midwife to provide me with that information through the way of their patients. And we get to work. The treatment schedule varies for those types of patients, and the treatment schedule varies for women without breech presentation as well. Usually what I tell most patients is that it'll follow your OB schedule. So in the very beginning, when you're seeing your OB or your midwife once a month, you're seeing me once a month. And then once you're seeing your OB once every 2 weeks, you're seeing me once every 2 weeks. Once you're seeing them once a week, you're seeing me once a week. That might change depending on the pain or the pain that you're dealing with during pregnancy. So if I think that we need more care, then I'll provide more frequent care. Another thing that I do work on too is pubic symphysis pain. So pubic symphysis dysfunction. A lot of women will explain that to me, that they are having pain in their pubic bone. I can adjust that area as well. Adjustments are what we as chiropractors provide to the spine and to the joints of the body. So I can adjust using a vibration technique, adjust the pubic bone. So that provides quite a bit of relief to patients with that symphysis pubic pain during pregnancy and postpartum too.
Absolutely. And I think this is where, when I meet patients, they ask me, well, who should I go see, the PT or the chiropractor? And I think my answer always to that has been, well, why not have a bigger team of
Both.
people helping?
Yep.
Exactly. And each of us have our different specialties, but are approaching the body in a very similar way.
Yep.
So while Joelle and I both can do the adjustments to the spine and the pelvis, certainly Joelle is incredibly skillful at manipulating through the spine and the pelvis. And then I can help with the exercise piece, even though Joelle can do that too. So we try to build our team together so that there's good overlap and communication between both. And what we see is that enhances the carryover and further reduces pain and allows our patients to have really great success.
Absolutely.
So, Joelle touched upon pubic symphysis dysfunction, which occurs at the front part right above the vagina of the pelvis. Some of the other areas that we commonly will see pain in the pelvis are right at the bottom of the low back in what's called the SI joint. And this is the spot right at the base of the spine where the wings of the pelvis join the sacrum bone, which is the sacral bone, which is the bottom of the pelvis. It's shaped like a triangle. So oftentimes people will have pain on one or both sides of their pelvis in the lower portion, or just above the vagina in the front in the pubic symphysis. We also can see that people will have pelvic pain internally. So this presents itself as either pain with bowel movements or going to the bathroom and urinating. It can be pain with sex. It can be pain with OB appointments with internal assessment or use of the speculum. And those types of pains typically are handled more by the physical therapist because we will do internal vaginal work for those. So even when pregnant, we can do internal vaginal muscle releases, which will help to reduce those instances of pain with things like sex and going to the bathroom. For the pubic symphysis and SI pain, this goes back to what Joelle was talking about earlier with manipulating the pelvis and the spine, as well as then building some exercises around the abdomen and pelvis to help stabilize those structures so that they don't continue to move out of place. Anything else, Joelle, that you wanted to add into that component of things that you found to be successful?
No, let me just touch on the fact that, of course, low back pain as being one of the major things that I treat. Not just pelvic pain too, but low back pain, just generalized low back pain in pregnancy. And I forgot to touch on postpartum when patients might want to see me postpartum. And a lot of the women that I see postpartum, or if they aren't coming to me while they're pregnant, but they're only coming to me postpartum, a lot of the time it's for upper back pain. And I know this is a little bit more on the pelvic floor side, pelvic floor PT, but just to touch on what chiropractors can do a little bit postpartum, that upper back pain and that thoracic pain from breastfeeding, hunched over, bottle feeding, from holding the baby and just oohing and awing at your baby and looking down. So lots of neck and upper back pain. And then just as a guide, what I tell most of my patients is, because a lot of patients will say, well, can I come before the 6-week follow-up with my OB? And the answer is yes. A lot of the times I'm recommending my patients come to see me within 2 to 4 weeks of delivering. And and it's usually, I leave it up to the mother, of course. It's whenever you feel most comfortable. If you would rather wait for that 6-week appointment with the OB, that's absolutely fine. But I can modify my treatment based on the birth and based on how you're feeling that particular day. So I definitely tell my patients to make sure that they're not, and this would be the same with PT, make sure you're not waiting until that appointment to address your pain and to address what's going on with you. If you have concerns, if you have concerns a week after, if you have concerns 2 weeks after, if you've already talked to your OB and you still have concerns, you reach out to the rest of your team, Kristen and myself, to make sure that you're getting the care that you need in those first early postpartum days, which can be really difficult and, could require support. So I just wanted to touch on some of the other chiropractic things that pregnancy postpartum brings on for me.
Absolutely. And I think that's such a great segue, that in opening the door with that postpartum talk, because even though, many of our people joining us today might be in the prenatal phase, we really want to start planting that seed early for once the baby comes. Now we've got the rehabilitation from having been pregnant for 9 months, which,
Yep.
when we think about all of the body changes that occur, there's so much change and the body just starts to almost take on a different shape, has different function. And so we've got to rehabilitate that effectively postpartum. And Joelle touched upon some of the really key components for what we're going to look at postpartum is that neck and upper back function, making sure that you have the strength necessary to perform the lifting tasks that you need, including carrying the humongous baby carrier and, wearing the baby wearer and, reaching in and out of the crib. We've got a whole new host of tasks that the body isn't quite used to and prepared for, nor has the strength because it's been virtually incapacitated for 9 months. Certainly, postpartum on the PT side, if someone does have a episiotomy or a vaginal tear during delivery, this can cause a lot of issues postpartum, particularly with the resumption of normal sexual activity, can cause a lot of pain in the vaginal opening. So physical therapists would be there to help kind of loosen up that tissue of the vagina and allow the scar tissue to improve its how it lays down so it's not so painful. We also will look at improving the pelvic floor strength. So if you think about it, you take a watermelon and you push it through the pelvic floor. We've done a lot of stretching to the muscles of the opening of the vagina as well as the whole pelvic floor. So we'll teach you an effective Kegel on how to improve the strength, which will then improve the stability of your pelvis and prevent things like pubic symphysis dysfunction postpartum. So we want to make sure that we shore up all of those muscles around the pelvis and abdomen to make sure that they're functioning correctly. And then certainly, if someone has a cesarean section, obviously we know that's not anyone's goal is to go into pregnancy having a cesarean unless it is a subsequent labor. So with that, we're going to look at restoring the normal function of the abdomen and evaluating for what's known as diastasis rectus, which is the separation of the abdominal muscles. So whether it's cesarean incision or just the natural separation that occurs with carrying a baby to full term, we can look at how the abdomen is functioned because that's going to really control what happens at the spine. And we know if we let that go, it causes spine problems down the road. So Joelle and I will both be very mindful to make sure that we see really good abdominal function, really good pelvic stability to prevent future issues.
Absolutely.
Joelle, any issues when pregnant that would prevent someone from being able to see a chiropractor? Are there any concerns or things that you would say, hey, you might want to talk to your doctor about this before seeing a chiropractor?
No special concerns. I ask quite a bit of questions about the pregnancy when a patient first presents to my office. Of course, your standard questions: how far along are you? How many pregnancies have you had? How many children have you had? We talk about how those births have gone. If there are previous births, were they vaginal? Were they successful? How long were they? Any previous pelvic floor experience? Anything like that. There are no specific pregnancy complications or high risk pregnancy considerations that I have to commonly, I don't have to worry about or say no to a patient for anything like that. And of course, I just get a great history surrounding all of that so that we can have a very good appointment and I can have a very thorough approach to how to take care of that patient. With chiropractic care during pregnancy, it's extremely gentle. Most people will recognize chiropractic care as the cracking, if you will, and the manual manipulations that we do outside of pregnancy. While a patient is pregnant, I make modifications to that type of treatment and usually use tools, my table and an actual adjustment tool to adjust the low back and the pelvis, while keeping the traditional techniques for the neck and the upper back if we're treating those areas as well. So it's very safe, very gentle. I always joke with my patients on their first visit. I said, listen, this is going to feel like I'm really not doing much of anything. But it provides an immense amount of relief, usually very quickly for a lot of patients. So of course, I'll take into any considerations about that current pregnancy. Are there any high risks? What might be going on? I love connecting with providers. So if the providers are willing to have a conversation with me, if they feel they need to, I'm very open to that. Most of my communication just goes between patient, me to the patient, patient to the OB, and vice versa. So there's nothing really to be concerned about or to look out for. Yep.
Absolutely. And, I can echo that same sentiment on the physical therapy side of things as well. And one of the great things about both chiropractic and physical therapy in the state of Pennsylvania and Delaware is that you can access both of our practices, both of our styles of practice, if you will, without a physician referral. So
Yep.
you can walk right into a chiropractor, you can walk right into a physical therapist, have an evaluation without having a physician referral. Now, there are some insurances that require that for payment. However, in the state of Pennsylvania, which is where I can speak since that's where I practice, you can typically come for up to 30 days without that physician referral without any issues on most of the major insurance companies.
And
Yeah.
I can make that referral as a physician if need be. So just for those patients who need that physician referral, I count as that physician. It doesn't have to be the OB, it doesn't have to be the primary care in most instances.
Mhm.
I will gladly write that referral and do very often. So
And
just
so,
throw that in
yeah,
there.
absolutely. And so what's nice is that, when you have, or when you are pregnant, like Joelle mentioned early on, it's a great preventative care measure is go in and see a physical therapist, see a chiropractor,
Mhm.
get a once over, make sure your core is functioning correctly, joints are aligned, pelvis is in, correct position, and you're demonstrating the correct movement techniques that are going to keep you safe through the pregnancy. And both the physical
Yep.
therapist and chiropractor working side by side can do that. Certainly, we want to be really mindful about those high risk pregnancies, like Joelle mentioned, where we are going to be communicating, with your OB or your doula or whomever it might be, if there are any specific concerns. On the physical therapy end, that's more particular when we're doing internal work. So certainly we'd have to have that conversation to say, okay, what are the limitations and or precautions that we need to take in terms of a high risk pregnancy. But the beauty is, you can come and see us both immediately
Mhm.
when you're pregnant. You can do it before you're pregnant, or you can do it immediately postpartum, so that we can start that road to recovery after the baby comes and make sure that everyone is functioning as healthy and happy as possible, because it can be a very difficult time.